Hello, welcome to my channel. Today I'm going to talk about electroconvulsive therapy and what does have to do with the treatment of depression. So let's begin. In this series of short movies about electromagnetic stimulation and especially electromagnetic stimulation of brain, I was talking previously about some novel kind of stimulation, but to understand all of this, we really need to dive deeper in the history of electromagnetic stimulation. One of the first applications of electric stimulation in the brain was during the brain operations on open tissue, when Penfield actually put the electrodes in a patient who was anesthetized, but he was conscious, to actually take care of very subtle differences between the regions he wanted to avoid to damage with a surgical procedure. So that kind of electrical stimulation is called electrical stimulation, and it is actually reserved only for surgical procedures, because otherwise you wouldn't open the head of a patient just to experiment on them. No single ethical committee would approve that. But what is actually electroconvulsive therapy? First of all, to explain, convulsion means activity of the muscles which really resembles the state when a person, for example, has epileptic attack, meaning that due to certain electrical stimulation in the brain or events in the brain, because it can be a natural cause, there is a series of reactions from all the muscles of the body that we called convulsion. So, electroconvulsive therapy was first discovered in 30s in Italy, but by Professor Cerletti. He was a neurologist and a neuropsychiatrist, and he and his colleagues actually tried first time that on a patient in 1938. At that time, they didn't use anesthesia. There are two types of electroconvulsive therapy: when you put electrodes on head, on temples, or it can be unipolar stimulation, which is newer technique. So this generation of electrical field, which as a consequence have a certain amount of electricity to enter the brain and comes from one electrode to another, passing to the tissue, used to be painful, because in the skin and in tissues which are on top of our skull, we have receptors which translate that sensation to pain. But it lasted to 60 seconds maximum, and even shorter. And during that electrical stimulation, it happens that you actually induce a kind of seizure in a patient. That used to be applied in patients who have really severe psychiatric disorders. And today, electroconvulsive therapy is applied together with anesthesia, of course, and it's completely different kind of experience that patient can have, but it's seldom used only in cases when nothing else helps. For example, in treatment-resistant depression. Treatment-resistant depression is so severe depression which did not positively react on any tried treatment. For example, in clinical practice, it usually means that that patient didn't react on several different sorts of medication that were tried, and the quality of life is so low that there is a high suicidal risk in that person. So in that case, it is there is a justification to apply this kind of technique. Also, this treatment can be applied in people with catatonia, or if they have mania, in bipolar depression disorder. But today, this is applied only with informed written consent by the patient. Anesthesia, total anesthesia is applied, but there are some side effects in some of the patients. For example, a person can feel a little bit confused after the treatment, or it can suffer from temporary loss of memory, and that can last for a couple of hours after the stimulation, from 15-20 minutes to a couple of hours. That person after the treatment also can experience nausea or uneasy feeling of, because this is a shock for the whole organism. But from the point of view of clinicians who are working with severe depression cases, there are some reports that patients actually react really well. Just to put that in perspective, if a person is treated with medications, there are some data, especially from study from 2017, that only between 11 and 26% of population are reacting within the first year of that treatment, which is pretty low. If we apply other forms of treatment, combination with psychotherapy and some electromagnetic stimulation, there is also increase in that percentage, but electroconvulsive therapy is actually helpful sometimes in 83% of the patients, and this is especially recommended in patients who are at high risk of suicide.